Okay, we're just about ready to get started. Still have some people logging in and dialing in, but also want to be conscious of those of you who've been punctual and came in on time. Really excited to have everyone here today. I know it's the week before the holiday weekend, and I'm sure everyone's got lots going on, but this is a really important topic, and I'm really appreciative that all of you have joined us today. We want this to be as interactive as possible, so please feel free to use the Q&A and chat functions to ask questions throughout. We may only get to them at the end of the webinar, just to keep the flow going, but certainly interested in hearing your take on some of the things we're going to discuss today. And of course, today's webinar is how to boost retention during the Great Resignation. And that's a term that we've all been hearing a lot about recently, usually associated a little bit more with corporations and companies like that. But what's interesting and why I think the Great Resignation is so applicable to the home care industry specifically is because of how many of caregivers are actually leaving the industry, right? So in the past, maybe we saw a lot of turnover, and maybe we would have called this how to boost retention during the Great Turnover or during turnover. But the Great Resignation is actually a challenge that we find many of our clients and many home care agencies are facing because people are actually leaving the industry. I want to introduce our panelists today, two people who are just really, really excited to have with us. First, we've got Vicki Hoak, who's the CEO of the Home Care Association of America. For those of you who may not know, definitely go to their website and check them out. But the Home Care Association of America deals with over 4,000 agencies across the United States. So has a really, really, really great presence, heavily involved in education, heavily involved in advocacy. And Vicki's got an excellent purview of what's going on in our industry, and really, like I said, across the entire country. Also very fortunate to be joined by Mayer Majer today. Mayer is part of Leading Edge Administrators, a third-party administrator. We've been very fortunate to work together over the past few years on mutual clients in the home care industry. Leading Edge deals with tens of thousands of caregivers across multiple states as well, and focuses on the benefits and things like that that are important for caregivers. And therefore, I think Mayor is going to have a really, really great perspective today on what is it that home care agencies need to offer, what is it that caregivers are looking for, and how do we both attract, but more importantly for today's discussion, retain caregivers once they've joined your agency.
Wow. Way to add the pressure, man.
Thank you. So thank you, Vicki and Mayor, for joining us today.
Thanks for having me.
It's good to be here.
Thank you so much. So before I get to some of the questions, and we've got a number of questions, and of course, you encourage all of you to reach out with any questions that you have that you want us to ask. But before I get to those questions, I want to just set this up and mention two things that I think are super, super important. And the first is a little bit it comes from my own background. I've been in human resources for over 15 years now, started out in the tech world. And I remember I once joined an organization that was going through a very rapid phase of growth. When I joined the organization, they said, we want to go from 700 to 1,500 employees in a 2-year period. And I remember discussing this with the leadership at the organization, and they said, what's your plan? How are we going to hire all these people? How are we going to attract them? And I looked at our numbers, and we were very fortunate to be keeping track of a lot of the important data. And they said, well, actually, we're not going to start with recruiting. We're not going to start with that side. We're actually going to be starting with retention. Because if we don't lower our turnover numbers, if we don't lower our attrition numbers, we're never going to be able to hit our recruiting numbers. We're never going to be able to get to that point. And that's a very, very important thing I think we need to think about. In a recent survey, 80% of respondents said staffing is the greatest challenge that they have right now. But only 1/3 of the respondents said that retention was their primary concern. And I think we need to change that mindset a little bit. If you focus on retention, it's going to make your recruiting that much easier. We'll talk about a few different ways today, but just to give you one example of that, simply the cost involved with replacing somebody who leaves, right? Somebody who's got a relationship with a patient, somebody who's worked for your agency and knows the nuances of your agency, right? Are way, way heavier than recruiting that new employee. So if you just focus on retaining those employees and actually spending the dollars there and not just spending the dollars on marketing and trying to get new caregivers, you're going to solve a big percentage. I don't know if it's 50% of the problem. I don't have that data, but a large percentage of the recruiting challenges and staffing challenges are going to be solved through retention. The other thing that I want to talk a little bit about before we get to our panelists is around understanding the difference between attracting employees and retaining employees. I think sometimes organizations feel like if we have the right benefits in place, if they have the right policies, if we've got the right perks and procedures, well, that's just a blanket type of thing, and that's going to solve everything, right? That's going to solve all of our challenges. And I think we have to understand that there's a difference, right? There's a reason why people come work for your agency, for your organization. It could be the people. Maybe they've heard you've got a great staff, great office staff. It could be the work environment. Maybe they appreciate the cases that you have, the opportunities that you have. Often it's going to be the pay and the benefits, right? Let's face it, people need to get paid. People need those benefits, right? And that's why they'll come join your organization. So they may hear about it in recruiting materials. They might see it in some kind of ad you have out there. You've got a great work environment, great people, great paid, great benefits. But once they join your organization, that's going to change. It's no longer going to be, and this is based on research that we've done, it's not going to be so much around the people, the work environment, the pay and the benefits, but other things. Once they work for your organization, all of a sudden respect becomes important, right? How am I treated by this organization, right? Is my paycheck accurate? Do I get communication on a regular basis? Do I have access to people if I have questions? The manager, or again, typically in a case of an agency, might be a coordinator, right? That becomes important. How am I treated by my coordinator? Do they respond to my questions? Do they call me back? Are they available to me? Do they call me? Am I communicated with? So that becomes much more important once somebody is working for an organization. And then there are things that are consistent, right? So work environment is important. Career development is important. And then the one overlap that we found between both attraction and retention is opportunity. And opportunity doesn't always mean career opportunity, but it just means opportunity for improvement. That could be career. It could also be pay. It could also be benefits. It could also be work environment. But certainly when people are joining an organization and when people are staying at an organization, often it's for opportunity. So I think it's important for us to sort of set the table there and understand that the reason why people will stay with your organization are not going to be exactly the same as why they first joined your organization. With that sort of setup over here, I'd love to get to our first poll question for the day. So let's have a poll question here. I'd love to hear from you guys. Is your agency struggling with retention among your caregivers today? We know staffing is a challenge, but how's retention going? Okay. Let's see what we got. So yeah, I mean, again, not a surprise, but not, not 100%, but we have a very large percentage who say that, they're struggling with retention. And therefore, again, this webinar is certainly appropriate. And I'm sure we're going to cover some really great things today. So first questions for you, Vicki, what are, and yeah, we know some of the obvious ones, but maybe you can dig in a little bit. What are some of the most pressing challenges that you see when you're talking to your owners, when you're talking to people at these agencies? What are some of those pressing challenges that they're facing today?
Thanks, Avi. And I apologize. I completely lost you all for a few minutes, so I'm glad I'm back. I wish I could say something new and, something that no one ever thought about. But the bottom line is that as I've traveled across the country over the last 3 months, there's never a meeting that's held that the first sentence out of all of our members' mouths is always, I need more workers. And but that even gets worse when you think about the lack of our supply of workers right now. And now it's exacerbated because we're seeing an increased demand for home care as a result of COVID. And then you layer on top of that higher, the increasing cost of gasoline. So it is like, a huge challenge. I think the other thing that folks are dealing with is the need. And I don't think, the response to all of this is always, okay, we've got to increase our wages. We are seeing that across the board. Home care agencies are indeed increasing their wages, especially when that state increases their minimum wage. But let's face it, usually home care agencies are already above the minimum wage. And then we have to balance that out with keeping home care affordable, which is something that is really important. Family funded, family paid home care is mostly the type of care that we're getting right now. It's families are paying for home care themselves because Medicare doesn't pay for it. And we have this middle class that's a little above the Medicaid eligibility. So there's a lot of families that are doing family funded home care. Well, if we have to continue to increase our wages, which absolutely is needed, and gosh, no one on this call is going to debate the fact that how valuable our home care aides are. But at the same time, we've got to try to keep home care affordable.
Yeah, that's great. And again, some of the things you're mentioning sound like they're, call them maybe cyclical, when we have inflation right now in gas prices, and hopefully that'll
Hopefully.
Hopefully it'll go away soon or go back and that'll balance things out. But what you're saying is based on the supply and demand sort of, part over here, that's going to be there, probably long-term, right? Because we don't have
long term. And we know it's only going to get worse, right? As our elderly population continues to grow.
Yeah, that's great. That's super helpful. And I think, again, a good way for agencies to sort of frame that challenge and sort of what are the things that we can sort of deal with right now, because there's some of the short-term challenges, while also taking a look at some of those longer-term things that we know will always be here. But, again, I think when I think about retention, I think about that, right? That's sort of that long-term play, right? If I can keep, I recruited somebody, I spent that time, spent that money, I can keep them here, right? That's a long-term play. I think I mentioned you before, and I mentioned this in a previous webinar. One of our clients here in New York recently told me that they have almost 2,000 caregivers that have been with their agency for over 10 years. And, I think it's just incredible. I think there's so many,
yeah.
right? And even
That's
beyond
great.
just the fact that the number's incredible, you think about the benefit to their organization, right? In terms of having that pool of candidates, in terms of potential referrals. So I think they're in the process of solving some of that challenge, right? And perhaps if some of the other challenges are short-term, like rising gas prices and things like that, they might be a little bit better off in terms of being able to get through this. Super helpful, Vicki. Thank you so much. So just before we get to Mayer, I was going to talk a little bit about the benefit side of things. We thought we'd ask the crowd here, get some feedback from you. What are the most popular benefits when you think about your staff, your caregivers, what they're looking for? What are some of those popular benefits that they want? And we're going to pop our poll up here in a second. All right, we're going to do the poll. Let me see. The poll's not working. Okay, sorry about that. The poll's not working, so we're going to skip right to our next other panelist. What's that?
Skip this. I thought you were going to skip that too.
No, we're going to get to you now, Mayer.
Okay.
So again, Mayer, I gave you that introduction before about the fact that, again, you and I have been working together for several years, and one of the things that your organization focuses on is around benefits, right? And certainly some benefits are kind of standard, right? Maybe not, maybe they're not so standard. But when you're sitting with organizations today, and I'm sure they want to have that conversation around what are the benefits that are going to get people to come join our company, right? What are we going to do? The sign-on bonus and all the other stuff that we can do. But when you're sitting there and saying, okay, that's all great, but here's what you need in order to retain your caregivers. What are some of the unique benefits that you're offering or that you're seeing out there in the market that organizations are doing to make sure that their caregivers stay with them?
So, I mean, just to piggyback on what you guys just discussed with.
Oh, hold on one second. Now the poll went up. So hold your thought there. Think about
my magic touch.
There you go. Appreciate it. So let's talk about those popular benefits. You have more time to think about the answer to that question there.
Every second counts.
All right. Okay, let's see what we got. So yeah, again, health benefits certainly got most popular. One that's been interesting, and the other, well, actually the most popular one, interesting enough, is flexible scheduling, and I think that's becoming, again, something that's super important to lots. As caregivers, and something that I think is important also, Mayer, you can comment on this, but I think also when you're thinking about who's joined that workforce, the caregiver workforce, right? And it might be people who may not be looking for it as a full-time position. Maybe it's something part-time they can do, that flexible schedule is certainly going to be important. Health insurance is certainly important. And the other one that we've seen kind of popular recently, and Mayor, I don't know if you have got thoughts on it, but we will go back to your question in a bit, is the same day pay. Right. We're hearing that from a lot of our agencies that we work with. They're super interested in it. They want to know what our thoughts are on it. Are people taking advantage of it? Back to what Vicki was talking about before, and things like rising gas prices and those kinds of things. It's not unheard of in our industry where even though employees may get paid on a weekly basis, but maybe by the end of that week, they no longer have money for their bus fare. They no longer have money for their train fare. And they're not asking for a handout. They're just saying, hey, I need to get paid a little bit earlier this week. I had an unintended circumstance. I had something like that. If only we had, daily pay or same day pay or something in there, maybe I'd be able to take advantage of that and be able to get to what I need to do. So thanks so much, everyone, for participating in that. But just going back to you, Mayor. So what are some of the unique benefits that you think are helping these days when it comes to retention?
So before I get to go through the benefits that I think are unique, I mean, that's a challenge we all have. We want to give something different and unique and something that's going to help either retention and recruiting but just to contrast with the agency that you just mentioned, Avi, with what Vicki mentioned about giving higher wages. The reason why your agency was able to retain 1,000 aides, whatever the number was, for 10 years, is because of the culture. It's not because of the wages. Giving more wages, and Vicki touched on it, it only helps temporarily. People come to me, I can give myself as an example, they're using Leading Edge or going to Mayer Majer, not because Mayer Majer or Leading Edge is going to be cheaper than the next person. It's not a dollar and cents thing. It's where do you feel most comfortable? This agency that's keeping their 1,000 aides for 10 years is because they created a culture where the aides want to stay there. So, there are agencies, a lot of our clients are utilizing some benefits to make their aides feel more comfortable and more part of their quote unquote family. Whether it's, there are people giving care packages on birthdays. We all like to get a box in the, I'm 44 years old and I'll share it publicly. I still, when the Amazon truck comes and rings the bell, I hope that's for me. It's, so everyone likes that feel. The aides are made to feel part of their agency, and that's why they are staying longer. And to echo your sentiment, it's keeping the aides. You already invested in the time. You already took the training that you put them in the system. You don't want to have to recruit. You want to retain your aides. So that culture, developing that, there are many different ways of doing it, but I think it's refocusing and saying, how do I make the aides feel comfortable? If it's paying them more, then the next person who pays them more, they're going to leave and go to the next agency. So you want them to feel part of your home care agency. You want them to feel part that they're part of the family. So that I would just start with whatever the benefits are, just making them feel part of your agency, part of your. And I'll share with you a quick story. We had a client of mine told me that their HR person shared with me that an aide 2 years later was resenting the fact that they were forgotten when they gave out 2 years ago during COVID to give out these packages. And they forgot that employee, they totally forgot about the employee. 2 years later, they were complaining to HR and you forgot me. Why? Because it's something that they care about. It's something that they make them feel part of something. And if you can accomplish that, that's a big help in terms of retention. I was actually surprised to see the list. I don't know if you can pull it up again, but the flexible scheduling, to me, that as a benefits, that doesn't come from what we do, but I didn't realize how important that is, the flexible scheduling. But the same day pay, we know, and I'm sure all on the call have heard that that's a very big help. Avi, like you mentioned, the ability, whether it's gas, whether it's a bill that just came that you weren't ready for, whether it's your child has a graduation, you want to give them a $50 or $100. We're forgetting sometimes that it's paycheck to paycheck. So that's an important added benefit, which is easily something that you can implement into your agency. Aflac is something that a lot of our clients are adding because it doesn't conflict with their health insurance. So they have, whether it's critical illness or hospital or also many supplemental benefits that don't conflict with their health insurance, they're adding to their benefit package. I know we have recently a bunch of our clients called us up and said that they're losing aides to other agencies that are unionized. That's something that a lot of agencies are looking into. Unions can help in retention and help in recruiting with their added package, whatever their benefit package, and other added. I know I saw on the bottom, Avi, the tablet, the free tablet. The government. I know it's something you're doing. We're rolling it out as well, but it didn't have a high. I think it was a 10%, if memory serves correct. But it's just throwing that, we have a new benefit, a new something that we can give to your aides. The government's paying for it, but you're basically implementing it. You're getting it done. You care about your aides. During the pandemic, we had this pandemic relief fund, which the aides were able to use their flex cards for anything and everything almost. So it's thinking about them, showing that you care about them, and pivoting and getting other benefits, and showing that you're not just keeping it monotonous. You're trying to bring more into their lives. So I think all of those, whichever talks to you, but that talks to the aides.
Yeah, those are great points, Mayor. I appreciate that answer. And it sounds like you're saying is I think people underestimate to a certain extent a benefit that you think might be a low cost benefit, like you were giving an example of sending something on a birthday, right? And how it reflects the culture of the agency. We care about you, right? And if we care about you on your birthday, then we're also going to care about you if you're not well, and we're also going to care about you in other ways. And I agree with you. I think there are certain benefits, right, where you may not have a huge impact, and maybe people only take advantage of it when they need to, like a same-day pay or something like that. But having it in place shows, hey, we care about you. We know what the challenges you're going through are. We know what the struggles you're going through are, and we're here when you need us to be here, there for you. And I think that's incredibly important. Just to add one interesting thing, I remember from my own career in HR, and we're again thinking about retention, and everyone offers a medical benefit or dental benefit, and we were trying to say, like, what can we make unique about our medical benefit? And I remember one of the things that we did was, sure, we educated our employees on how to take advantage of medical benefits, which are challenging, right? It's always challenging. How do I sign up, and how do I use my card, and who do I call, and how do I look things up? And I remember we also said, no, let's include the rest of the family, because maybe our employee isn't necessarily the one who takes care of a lot of the medical benefits, or maybe the doctor's appointments or things like that. I remember we set up a series of webinars, and other members of the family, whether it was a child, whether it was a spouse, were able to join. And all it said was, hey, we're not just using this benefit as something we have to do because the law says you have to have medical benefits, or because whatever it is. We want it to become something that you take full advantage of, right? And that sort of gave over this message of, we care about you. We want you to take advantage of this benefit. We want you to really feel like we're here for you if you have any questions. And I know we got a lot of positive feedback on that. So really appreciate that, Mayor. It's not just about the benefit itself, but also what's the message that benefit gives over.
1,000%. And I can't reiterate that as much. Enough. It's really not as important. Obviously, the benefits are important. But just showing that you care about the aid will help in the retention tremendously.
Yeah, absolutely. Really appreciate that. Thanks so much. Vicki, going back to you, and maybe take a step a little bit back from again, a lot of discussions around retention, but what are some of the things you're seeing as you say traveling across the country and meeting with agencies everywhere? What are some agencies doing currently to combat staffing issues? Yeah. Right, like you said, there's way more demand than supply.
Way more the demand and supply, and I think what I'm seeing I'll just call them the 3 C's, and Mayor has already mentioned one, and this is something that continually comes up when we survey members, and that is the culture aspect of being an employee of your company, and how important it is to have a culture, excuse me, of caring, that as a home care aide, you care about me and you care about your clients, of course, but I think that is showing up more than ever before when we ask caregivers, why do you stay with the company? Or why did you decide to go work for that company? It's a company that is showing them that they have a caring culture, I think the other C is the communication factor. At the height of the pandemic, which is that, okay, let me get my year straight. Guess it was 2021. We had the highest satisfaction rate for both caregivers and clients at the height of the pandemic. And you kind of pause and you think, why is that? Well, I think it was because we were communicating more frequently. We were talking about that, we've got your back. We're going to make sure you have PPE when you need it. We're going to talk to you about how do you protect yourself against COVID-19. We were dealing a lot with our clients, talking to them about how we were making sure when our caregivers came into your home, they were also protected. So I think communication is really important because it feeds into that culture. If I'm talking to you all the time about how valuable you are, how much you are part of our team, I'm going to get that sense that the whole company cares about me. And then that third C is credit. That continual recognition, giving our caregivers credit for the vital service that they provide. They want to feel part of a team. And I can tell you when an owner of an agency is sitting in a meeting and talks about their caregivers, I can immediately pick up on what pronouns they use, how they talk about whether, if they truly do have a culture of inclusion, a culture of caring. And those are the agencies that I think are retaining their caregivers now. But I think the most important thing, they're never resting. They're constantly thinking of new ways to, whether it's that daily pay that I hear a lot about right now. I'm also hearing with the gas, the South Carolina state government asked us because they're worried about home care continuing to be able to provide services and wanted to hear from our providers in South Carolina. What are you already doing to mitigate these higher gas prices on behalf of your caregivers? And we heard about stipends. We heard about how they're trying to schedule their clients a little differently to make sure that if one caregiver is caring for one, that the other person is close by them so they don't have to drive that far between the two. And I think it's just that constant communication and reinforcement that home care does not exist if we're not a team providing that care. And the team also has to include family caregivers. So that's why that communication, that culture, families of our clients should be feeling that too when they have contact with us as well.
Yeah, no, that's great points. And I love that you brought up the fact that, we've unfortunately through the circumstances of COVID learned some things. And I agree with you. I hope we don't forget some of those things.
Oh, I'm with you. Yes.
I remember when COVID, I wouldn't say started, we don't know exactly, but when it started getting to a point where agencies couldn't bring caregivers into the office, I remember some of our agencies reached out and said, hey, can you get everyone to sign up for direct deposit? Right? Because they're still coming to the office. They don't have a mailing address. They like to come to the office. We have agencies, very large agencies. We still have hundreds of people who need to come every single week, thousands of people who need to come every week to pick up a check. Can you help us with that? And we did, right? We went out there, we created these little videos, we created an easy process for people to sign up for direct deposit. And then so many of our agencies came back and said, why did we never do this before? Like, why did we have to wait until now? In order to, and again, it's just what you said before, it was just communication, right? We didn't change the way direct deposit worked. I don't work for the bank, right? It was just simply taking the time to explain, hey, here's how direct deposit works, and here's how you can sign up. And we did it multilingual so people could sign up and be comfortable with it. And then that first week when they just logged in the morning and saw the paycheck there, like, hey, this is great, right? And their feedback to the agencies, why didn't we do this before? And agency said, well, we've been trying to tell you this for years to sign up direct deposit. So I do agree with you. I think there are some things that we've learned about communication and reaching out and that extra touch and that extra thing that I think, I think some agencies are sticking with it. And I think it's a great step towards combating a lot of the staffing issues.
Avi, if I may add one thing, the other thing that I'm hearing is agencies now too, as far as trying to retain who we have, looking more seriously at career pathing, looking more at how can I keep this person happy and advance them. And I think that's another good thing that is long overdue. We need to make sure that we can keep that person and that person needs to have an opportunity to grow. Both wages, both in the, everything. And I'm seeing that. I'm also seeing agencies looking at how they pay their workers. We talked about daily pay. But I even had one agency say, you know, I'm looking at trying to do 40 hours a week, every week, no matter what, or 35. I mean, and then I've heard of some people saying, you know what, I've cut back on my marketing staffing and taken that money because I'm getting all the referrals I need right now because I can't keep up, and taking the money that I would have, you know, paid out to a marketer and putting that into more incentives, more benefits for my direct care workers, which I think is also indicative of what we're seeing right now.
Yeah, those are great. And to your point, it's about, again, if you have that mindset of, you know, what's in the best interest of my employee, how can I best serve my employee, and have that same mindset, right? So of course, our mindset is how can we best serve the patient, but you sort of balance that with how can I best serve my employees? Yeah, they're certainly going to be out of the game. Excellent, really appreciate that. Thanks so much. So Mayor, we're going to go back to it in a second, but something that you and I have kind of worked on for some time now is this awareness factor, right? You can roll out the greatest benefits package ever, right? And you've gotten, you know, great network. You know, you've been able to get access to great network. I know you talked about also, you know, partnering with unions in some ways, and some of that allows you to access even broader networks and larger networks. And there's different things that you've done in a very creative way. But what percentage, you know, we were asking the poll now question, but then we'll get to also, you know, what percentage of aides are really aware of the full benefits that are available to them? So Mayor, hold that for a second, and we'll get the poll answer, and then we're going to come back to you. Okay, wow. So the interesting thing is 10% of the respondents to this poll said that they believe 75% plus know about their benefits or aware of all their benefits, right? That means 90% of the respondents on our survey right now said that less than 75% of their employees know what their benefits are. And actually 50% said that less than 50% know about their benefits, are aware of their benefits. So clearly, and this also kind of piggybacks on what you were saying before, Vicki, is, you know, we can do a lot of things that we think are the right thing to do around retention, doing what's right for the caregivers, doing what's right for the patients. But if they don't know about it, it's, you know, it's that tree that fell in the forest, right? So Mayor, let me put this to you, right? So, you know, I want to retain my employees. I'm a home care agency owner. My employers out in the field, right? They rarely come into the office, if ever. And, you know, showd.me got them to sign up direct deposits. They don't even come in for their paychecks anymore. How do we make sure that caregivers have access to the benefits that we're providing them? They're aware of the benefits that are being offered. What are you doing as a TPA, as a third-party administrator, to help with that?
Well, first of all, I'm blaming showd.me because now they don't come into the office. So now, it's a challenge, and Leading Edge and the team, my team at Leading Edge and our whole, we are doing an amazing job. But the biggest challenge for a TPA to be able to let the aides know what their benefits are, even initially, not a change, is solely, I shouldn't say solely, but the demographic, and everyone on the call is aware, the demographic is a pretty transient demographic. The information we get from agencies, no fault of theirs, is sometimes incorrect or often incorrect. I lived in 3 different addresses my whole entire life. 21 years in one address as a child, 13 years when I got married, and 10 years, don't do the math, you'll know my age. But my point is there are aides that change their address 3 times a year. So when we get the information from an agency and we first mailing them kits, the return mail we get, because the information is incorrect, is tremendous. So we do a text, we do a text campaign. We reach out to every aide that has we have a cell phone, and we reach out to them, text them, please call or click this link so we can schedule an appointment or a time to discuss your benefits. I mean, Avi, you know, we've done this animated videos in multiple languages, trying to get the aides to be, to understand their benefits. And the worst thing is spending the money on a benefit. I mean, it's even worse than the tree in the forest, because you're spending the money for a benefit that they're not using and not utilizing. And sometimes, I mean, it's money. It's sitting there for them. Sometimes they don't need it, but often, I mean, we've had one of our clients had an Aflac benefit that it was a wellness covered. Every COVID test or vaccine or a annual physical, they would get a check in the mail. I can't tell you the percentage how low it was that they filled it out. I mean, it's frustrating because it's there for them, and the carriers want to pay it. The employer wants them to get paid. So it's a challenge. I mean, for the flex benefit, I'm happy to say, I mean, going back to your poll, we have on average, I ran a report, 70% of the flex funds are being spent.
That's amazing.
Which is very, but in all fairness, we have a majority, I mean, you have as low as 30 and 40% on the lower scale. It's on average. So so you have some that are spending, they're spending, they're maximizing the benefit 90, 80, 85, 75%. And that's because, they're more either out pushing it or they're being more, explaining it better to their aides with us as well. But there are a lot of agencies that even on flex, which is money sitting on the cards, they have 30, 40% utilization, which is a shame. So, we do have outbound call centers that we reach out to multiple languages. Ultimately, if you go to the other benefits, the MEC benefit utilization is really low. Some other benefits.
What is it? What is that?
That's preventative, meaning they're going to get their annual physical, you're getting a mammogram, whatever, all those preventative, utilize it. So it's frustrating because we all want the same thing, and sometimes it's just the challenge is getting the information to them and getting it out there, and we do the best. And I request of all agencies to try to more frequently update the mailing address and the phone numbers, especially now that the direct deposit, so you don't really need to have their address. But if you don't update it, they're not going to get the information, and they're not going to be able to take the advantage of the benefits that they already have.
That's great. Yeah, I think again, aside from that point you're making about the agency responsibility to make sure that you, as the benefits administrator who's willing to do the education and willing to do that marketing, their responsibility is make sure that I can get to the right person at the right time with the right information. And I know you and I have worked on different things, but I think that's a really good point you're making around, again, number one, let's make sure we can get to the right people through the right medium. But number two, I think it's around understanding the marketing that's involved. And I'm really impressed with that flex benefit number. I know years ago with multiple agencies, we talked to them and we were talking about, stuff that's put on an HSA card, right? And I think I'm using the right term. Is it FSA or HSA?
It's there are multiple. I mean,
the one where you could buy things in the pharmacy. Which one's that one?
That's we have. It's called a limited HRA, so it's LHRA.
Okay, so
or FSA, depends.
Right, FSA is I think the common one. And I remember going with one agency and they're like, we need to get our utilization up. And I remember they went out there and they did this amazing research on what things you could buy, whether it was like, things that people don't really think about. Oh, you can buy all your Tylenol, you can buy all your, there were other things that they found. I remember they found sunscreen, qualifies, and there's so many things. And as they started to market that, and they said, did you know that you could use these funds towards these items, right? You can buy Band-Aids, you can buy Tylenol, you can buy sunscreen, as long as it was above a certain SPF number was actually the criteria for, it's like above, like it has to be like, but and they start really doing this research and they would come back with lists, and every week we would help them, reach out to the caregivers and market these things. And slowly but surely we saw that utilization go up. So I think it's a really good point, Mayor, around, not only, being able to reach out to them and get to them and the education piece, but marketing it and saying, hey, you've got this money, don't leave it there. It gets wasted. And then also making sure they understand how they can spend it, right? Knowing that they have preventative resources available to them. Hey, you're eligible to go to the doctor once a year and you should take full advantage of that. Or you're eligible for some of these other things and you should take full advantage of it. I think is super important. Thank you for that. Vicki, one last question for you, and then we'll have one more question for me, and then we're going to wrap it up here. But, again, thinking a little bit more broadly, and again, you've got that great purview of working for an association across multiple states and multiple types of agencies. And I know that a lot of the work the HCAOA is around AOA, I should say, is around advocacy, right? What are some of the things that you're doing and others are doing? I think our audience would love to hear, what's going on in the industry, what's happening from an advocacy standpoint around this workforce shortage that we're seeing, that, it's doom and gloom. It's just going to increase. We're all fighting for the same people. But what are some of the things that you're either seeing or hopeful that we'll be seeing in the market in the short term?
I think a lot of our efforts right now are at the state level. We have state chapters that are very, very active right now, working on workforce issues, encouraging their Department of Human Services or their Medicaid program to increase wages for home care aides, utilizing that 10% increased FMAP that all the states receive from the federal government under the American Rescue Plan, making sure that those funds are going directly to home care aide wages. We're also doing a lot at the state level regarding minimum wage and making sure that if there is an increase in minimum wage, that there is a corresponding Medicaid.
Vicki, I think you froze there for a second. Let's give Vicki a second to come back. Sorry about that. All right, I'm hoping that Vicki will be able to come back, and I'll certainly ask her that question again. Maybe she's having some internet issues. So one last question for you, Mayor, kind of piggybacking on the last question we had there before. But when benefits do change, and again, I know you're always upgrading and looking for what's out there. You're at every conference that I go to, and constantly looking for new things, and we have lots of conversations around this. But what's the best way to let your caregivers know? I know you said before, gain accurate information. What other things can agencies do? Can we do to make sure that they know what's out there and being offered?
So, as I mentioned, the challenge is getting that information to them. So, when a benefit does change, we go through the regular route of having the new benefit sent in a mailing to them. But like we mentioned, that is obviously with the addresses very often not being correct, so they're not being notified about that. We then go ahead and do a call. So we'll call all the aides and let them know, and hopefully we'll get the right language. And very often they don't pick up the phone because I'm sure as you and I, we get enough spam calls. So, very often they won't call. We
have to make sure it doesn't come out of the scam likely.
Yeah, well, I have a report that the aides have just, the caller tried 3 times, and after the 3rd time, they're like, we left a message. So we'll do the text campaign and let them know that there's a new benefit. Please click on this link to get more information about it. We'll try to do those outbound campaigns to notify them. But more than that, it's a lot. We expect and hope that the agency as well will notify their aides, because they do have a more of a interact with their aides, and they, I know someone told me that they get the best results with text messages when they come through you, because the aides know it's something something important that they have to open up the text message, and it's not a Citibank freezing their account and some
Right.
spam text message. But together with the agency, they have the relationship with the aides. We have the technology and the benefits. So we work together with them to try to get as many aides touched and notified about their new benefit. But I'll be honest, it's a challenge.
It's a challenge. Yeah. Yeah. It certainly is, and I know, great point around, you were saying, sometimes, find that right medium, and I know it showed me we have that responsibility, right? We're often reaching out, whether it's to do their compliance training or whether it's something else. You mentioned before, we have a program now where we're helping them sign up for free internet and free tablets, and again, they don't believe it, right? They honestly feel like that's scam sometimes. But the advantage that we have is it's also coming from the same phone number that said, hey, your training is required, or your in-service is due, or anything like that. Vicki, you're back. We'll come back to you in a second. I definitely want to get back to that question. We moved on, but then we're going to come back to you in a second. So yeah, certainly, again, I think agencies need to understand what's that medium and test it, right? So use I remember, like you mentioned before, sometimes we've done animated videos to explain a concept to a caregiver, and that's fine. What if it's a QR code, right, that takes them to a website, or things like that? Be creative and agencies need to be creative. If you're rolling something out and you really want to get that adoption, try to be creative in how you're rolling it out, how they're getting the information, spend the time. You know, I know a lot of our clients are New York State. It is a multilingual state. So if you're rolling something out, yeah, take the time to make sure it's translated into multiple languages, right? And you'll be really impressed by the response that you get if you don't send everyone the same message in English, but you actually break it up and say, hey, you need to understand this in Spanish or Mandarin or Creole or Russian. We're going to make sure that you have that available to you. So I do think goes back to what we were talking about before, sort of turning it into a marketing campaign and making sure the message is being heard by everybody.
But in spite of all that, Avi, I don't know if I mentioned this to you a while back, we had one aide had, I would say, I think $7,000 sitting on a flex card. We reached out, wasn't interested. I begged the agency to reach out to the aide themselves. The owner got on the phone, spoke to the aide. Mr. Smith, you have $7,000 on your flex card. He goes, okay, you can use it. And okay, do you have the card? Yes. Will you use it? No. So there are certain times,
yeah,
like back to your tablet. Sometimes as much as you'll do it as much as we can. So you can only do X, and after that you just hope and pray that you reach enough people that realize that the benefits there for them, and there's no it's not a scam.
Right. Yeah. I think you're right. I think there's fortunately a lot of those are few and far between. Those people who are willing to leave that much money. But I think your point, what you're saying is, hey, it's not a checkbox. You can't just check the box and say, hey, we do dental, we do medical, we have a 401k. It's what are our participation numbers, right? And really focusing on that. What are our participation numbers? Are people participating? If they're participating, are they taking advantage of it? If they're taking advantage of it, right? Are they getting what they need? And there's different ways you can get that information. I'm sorry, Vicki, you cut out before. I do want to go back to that question before, and you were talking about where we lost you was you're talking about minimum wage, making sure that there's two sides to it, which I thought was really important on the advocacy side. We often hear about minimum wage. I think from a political standpoint, we hear minimum wage, and I think everyone on this call who are owners or people working at agencies say that's great. We would love to increase wages, but the reimbursements have to match.
Exactly. And again, in New York specifically, they passed a $2 increased wage that goes into effect October, another $1 the following October. They did indeed up the Medicaid rate, but they did not think about that family funded. So those agencies are going to also be hit with that mandatory wage increase without any kind of supplement. So again, that's an issue. I think the other thing I wanted to mention was we have announced last month the creation of the Home Care Workforce Action Alliance. This is a group that we established with the Home Care Association of America and the National Association for Home Care and Hospice. This is an alliance that is focused on coming up with definitive steps to address and mitigate the workforce shortage. So we are indeed having our first meeting in August. We have work groups that we will be establishing. If any of your viewers are members of either of those associations, we encourage you to volunteer. We're going to be looking at wage and benefits, career pathing, supply and demand, training, and of course, elevating the profession, which is something we've all talked about. So we're excited about that initiative, hoping to have our action steps ready to go by the end of the year. And then, of course, we're working a lot with some senior groups to try to get some kind of immigration bill introduced in Congress, which we all know if we're really going to have an impact on mitigating this workforce, we've got to look at immigration as one solution.
Yeah, no, and I love all your responses. And again, we'll send out, if you send us the information, we'll send it out to this group about the alliance. But I also agree with you on that last point on immigration. I know the other, I believe in Canada, they've actually created a process where you can potentially fast pass immigration if someone's qualified to step into one of these roles. And I agree with you. Again, not something we can impact tomorrow, but certainly again, we do, as associations can and other groups can, to advocate and to lobby, your politicians and talk about that and say, hey, this is something that can really have a positive impact, by being able to, bring people in who have already been trained as caregivers, being trained as CNAs, and if they're in the skilled nursing industry, and could really be a huge help. Well, Vicki, Mayer, I really appreciate so much. I think I'm going the wrong way here. All your responses today. We're just going to leave it open if you can stay on for a couple minutes, see what questions have come in from our audience. So let me take a look at those. Okay, we've got a question here. And if anyone has any other questions, again, feel free to use the chat, feel free to use Q&A. And here's an interesting question that I got. Can you discuss the importance of regular employee evaluations and their effect on employee retention and or weeding out those that need to go? I think there's always a struggle between too much feedback and not enough. Vicki, I'm gonna throw that one to you. Has that come up? How have you guys heard about that?
It just maybe in some informal sidebars, but I think it's a really good question, especially for the group that we're talking about. Everyone wants to know how they're doing. Everyone wants that feedback. So whether it's positive or negative, I think it is something that is a good thing to do with great, tact and understanding, and how can I help you improve, kind of that. And so I think and I would imagine that those kinds of evaluations are not routinely done with the employees that we're talking about. And I think they're needed, absolutely.
Yeah, no, I agree with you. And as we were saying that, I was thinking about, I think also if you roll out these programs with the goal of catching people doing the right things.
Yeah, exactly.
Right. I think sometimes we roll out performance reviews or evaluations and things like that with the goal of, let's see, who's not working out and what's not working out. But let's face it, most of your employees will be. So if you build into that, and I've actually met with a couple of companies recently who are very focused on that in the home care space. And how do we reward those employees who show up on time every day? It's not a given. It's challenging, right? Who show up on time every day, who clock in and clock out properly, who properly fill out the plan of care, who properly follow the plan of care, right? There are, all these little tasks that happen. And I was talking to someone about this the other day, and he said, well, isn't that like that in every industry? And I said, yeah, but you know what? There's a lot of industries where, you work in an office, people see you're doing a good job, your boss sees you're doing a good job, and say, hey, you're doing a great job, right? And this is an industry where everyone's out in the field and there isn't an opportunity. And therefore, often the coordinators or people in the office will only hear about their caregiver if there's a problem. They didn't show up today. They didn't show up on time. They're not communicating properly. But what about the 95%, 98% of the time where they're absolutely doing a phenomenal job? So yeah, I think there's, it's a great point. I think, feedback is needed. I think feedback is important. I think it does lead to employee retention when you have a system in place. It's hard, again, in our industry, people are out in the field, but you can certainly put systems in place where, people are recognized for, it's not just, doing their job, but they're just doing their job. You know what? Everyone's doing their job, but we like Mayor said, we still get excited when the Amazon truck pulls up.
Yeah,
they're just
I'm with you, Mayor.
I'm like, Santa came early this year. I'm like, yeah.
That's funny.
I think another thing, we're having a session for schedulers that's coming up on July 14th. Another group of people who usually are someone that's done a great job as a direct care worker, and now this is a career path that they have become a scheduler. Some people call them a care coordinator. But that group is really often mentioned as the glue that holds that home care agency together. That if you've got a good scheduler, you're going to have a successful agency. So we've now had an annual scheduler webinar, which we get an unbelievable turnout because these folks don't get to talk to their peers. And so I think that's on July 14th. So you might want to just go to our website and see, because I think that's another way to recognize people, to have them be able to just talk with their peers, because they're pretty much lone rangers out there trying to, balance a lot of different job responsibilities.
Excellent. Really appreciate that.
I never thought about that. And you only hear, because they're on a remote and they're working not in an environment, their work environment, so you don't see everything else that they're doing correctly. You only hear, like you said, they're late to a shift or they missed a shift, etc. And you don't interact with them to see all the ways that they're actually doing their job correctly. It's a good point.
Yeah. Excellent. Well, I don't think we have any other questions. I guess we covered everything else that people were looking for. Mayor, Vicki, thank you so much for participating today. This is super helpful. We recorded it. We're going to send that out to you guys as well to use. And again, any information you guys want to share, you want us to send out to this audience. Thank you so much to the audience, for your questions, for your participation. And yeah, look out for some more webinars. We've got a couple more coming up. It's summer, people are out, so maybe we'll do one over the summer and probably a couple more in the fall. So look out for those emails about some other upcoming webinars we're going to do. But thank you all so much and have a great rest of your day.
Thank you, Avi.
Thank you. Thank you.
Thank you all.